Okay, now tell me first about your symptoms before the surgery.
I've had back pain for 10 or more years. Been afraid to have it operated on.
Why were you afraid of getting it operated on?
I was just afraid of the procedures that they go through,
yeah.
cutting you open, having a big incision in the back and a big incision in the front.
So you did talk to some other
I
doctors,
talked to
right?
two or three other surgeons.
Two or three
yes.
other surgeons. Now, don't tell me the names, but what did they tell you what they would be doing for you?
One of them said that it would be how long? 12 hours?
8 hours.
8 hour
8 hour
surgery.
surgery.
And he would do a fusion in the back 3 vertebrae. And he would,
That's exactly what we did yesterday, by the way.
and he would have to cut me in the stomach in order to fix the discs.
Yeah, yeah.
And
Did they tell you about hospital stay, recovery, things like that?
I don't remember what that was.
6
but,
months.
6 months.
yeah.
Okay. Well, your pain in the back and the leg before the surgery, can you describe it?
My pain in the back, I haven't been able to walk without a cane. And even with a cane, I could only walk about a half a block. And if I stood to make meals 3 or 4 minutes, oh, the pain was tremendous. Sometimes I felt like I was going to black out.
Yeah.
I had to sit down because the pain was so bad.
Now, when I came here first, you just told me that you see him walking better. What did you mean by that?
Well, he used to shuffle his foot and could barely walk, and he got up with the walker and he was raising his foot that he couldn't raise before. Not noticeable grimacing pain on his face anymore.
Yeah.
It was a noticeable difference from just
Yesterday
yesterday
to
bringing
today.
to the surgical center
Yeah.
to him getting up last night and walking.
Yeah, well, we did actually 3-level fusion yesterday, practically same level that the other surgeon wanted to do.
Yes.
And our surgery was less than 1.5 hours. Our blood loss was half a cup of coffee. And the surgery was finished in the afternoon. So this is not even 24 hours.
No, it was 4 o'clock before, when we
Yeah.
finished, and it's
Yeah.
10 o'clock now.
So, and they are telling me you're cleared actually to go home after this 3-level scoliosis correction with spinal fusion. Now, before you go though, how is the leg pain that you had before the surgery?
Before the surgery, I had a pain in my hip and all the way, in the back, of course, and then it was in my hip and down the back side of the leg all the way down to the thigh.
How is that pain now?
That pain is gone. I still have some pain in this leg, but it's on the front side and just a spot, I think, where the surgery was, was performed.
No, so the typical pain you had in the legs before the surgery, it's gone?
Yes, I think it is.
When did it go away? When did you notice it's gone? Right after the surgery?
Right after the surgery.
Okay.
But I had other pains then.
Yeah. Yeah, obviously, we
Yes.
did a surgery. You
Yes,
cannot
you did
not
some
feel
cutting.
those. But the leg pain to go away is the hallmark of that the surgery worked.
Yes.
And it seems that, you're walking as well. You told me there was something about his height. What did you tell me?
He's gotten taller.
Yeah. Now, as a matter of fact, when we get old, our discs collapse.
Yeah.
And the bone becomes on bone, and people, in average, shrink a few inches. Now, what I did yesterday, I lifted up the bone from each other by putting a spacer. That is the reason the leg pain is gone, because I lifted the bone from each other, and that took the pressure off the nerve. And that is actually the same action that made him a little taller, is the action that take the pressure off the disc, of the nerve.
He's walking straighter and taller.
Yeah. Well, and we are not, this is not even 24 hours after the surgery.
And I'm not a young man.
May I ask how old you are?
I will be 80 in 1 month.
Excellent. And happy birthday.
Thank you.
But when we get older, obviously, healing is much more difficult. For that reason, many of our surgeons, they don't actually give option of big surgeries like that to elderly because it's just too dangerous. So I'm actually surprised that they even gave you the option of the surgery. But a body, even a younger body, behaves really very different from an 8-hour surgery versus, and your surgery was about 1 hour and 20 minutes.
Yeah.
And surgery that's 1 hour and 20 minutes. So this is a very good outcome. I'm very happy.
We are too.
Excellent.
Thank
Well, the plan for you is to go home and spend the rest of the weekend at home, okay?
Wonderful.
Excellent. Any question for me? Do you guys have any question?
No, you
Otherwise?
did a good job, I think.
Well, thank
So
you so
far,
much.
it's good.
So far, so good. Thank you. Have a good day.